Now I would like to invite Professor Dr. Georgi Chaltikyan. Professor Georgi is a well-known, renowned professional in the area of education. He is head of the Master of Digital Health in the Campus Rottal-Inn, Deggendorf. Thank you very much, Georgi, for being with us as well. It's not too early in Germany. It's about maybe more than dinner time. But thank you for your time. And please, you can introduce more yourself and start your presentation. That the title is The Need for Transformative Action. Please, Georgi.
Thank you very much, dear Jefferson, and thank you to the organizers for inviting me to be part of this flash course and overall of the educational efforts of the International Society for Telemedicine and Health. I'm assuming that my audio and video are coming through well, otherwise please let me know, and I'm assuming that my slides are also clearly visible. So let's go ahead. Yes, indeed, my name is Georgi Chaltikyan. I have several functions that are basically listed on these slides. My primary affiliation is with the Deggendorf Institute of Technology in Germany, where I'm a professor of digital health and head of digital health masters. I'm also affiliated with a leading university in my country of origin, in Armenia, where I'm also leading the newly established Master of Digital Health. I'm consulting the World Health Organization as a member of the Digital Health Experts roster. And I'm also founding president of the Armenian Digital Health Society and among the founding members of CONDIG that Jefferson mentioned earlier, the consortium of educational institutions in digital health under the auspices of the ISfTeH. I very much like to recently, in the past, let's say a year or so, to introduce my, or to set the stage for all my talks on digital health with this 7 seconds long video.
The world's biggest tech companies are getting into healthcare.
If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health. Yeah, this was just Tim Cook, the head of the largest and probably most successful, one of the most successful tech giants in the world, basically claiming that their most important contribution to mankind, to human civilization, will have been, in fact, digital health. So this is the content of my today's talk. What we'll be speaking about, we'll first review some of the concepts and definitions of digital health. Then I will very quickly introduce the recent guidelines and recent efforts of the World Health Organization in advancing digital health worldwide. And then we'll proceed to the topic per se, which is dedicated to digital health education, to capacity building and workforce development in digital health. We will have a quick look at the strategy, what are the different workforce or user groups in digital health, and what could be the approaches to digital health education that the World Health Organization and many other players, including the ISfTeH, are promoting and recommending basically to various countries around the world. We'll quickly review the various domains of knowledge, skills, and competencies that are necessary for becoming a digital health specialist. And after a few conclusions, I will also, with your permission, present in few words the Master of Digital Health that I have the honor of coordinating at our institution, the Deggendorf Institute of Technology. So this is a timeline of development of concepts in information and communication technologies that many of you should probably be or could be familiar with. Of course, in 1980s, the conversation or the most of the talk was about telehealth or telemedicine, right? That historically was one of the earliest usage of information and communication technologies for health. Then 1990s, the focus shifted a bit towards e-health with
electronic health information systems with electronic health records and other tools in 2000s, mid-2000s especially, so the introduction of the term mHealth earlier in 2000s, and then especially with appearance of smartphones since 2007, the focus began shifting towards more portable and mobile devices in usage of ICT for health. However, as we all know, in the past 5 to 7 years, since roughly 2015 and especially since 2018-19, we are primarily speaking of the wider domain of digital health. Now, why? This is basically the most recent or current definition of the World Health Organization of digital health, which is shown here on this slide as the field of knowledge and practice that is associated with the development and usage of digital technologies to improve health from inception to operations. This is just the first part of the definition that might seem quite obvious, but then we always say that digital health expands the concept of e-health to focus on digital consumers with a wide range of smart devices and connected equipment, and that it also encompasses other uses of digital technologies for health, such as the Internet of Things, the artificial intelligence, big data analytics, and robotics. And of course, the other concepts remain relevant to the field, such as telemedicine, telehealth, or telecare, e-health, mHealth, or health information technology, as people in North America are frequently referring to, or health telematics, which is a term that is more commonly used in Europe, especially Central Europe and in German-speaking countries. And there are also the fundamental scientific disciplines of biomedical informatics and health informatics. So I attempted to put all that in a single diagram, taking inspiration from the earlier picture published years ago by Frost and Sullivan that attempted to show the interrelation of all these concepts. And so here we have this overarching domain of digital health that builds on top of e-health, but also encompasses e-health, and that in turn includes the telehealth, and telehealth in turn includes telemedicine. So this is how we think of this. And then, of course, the fundamental disciplines, as well as applied science of bioinformatics, health and medical informatics, and health telematics. We think of digital health as of being composed of actually these eight domains. This is how we see basically the spectrum and the relatively broad or rather broad spectrum of digital health, which are the digital health records or electronic health records and information systems, digital health information systems and health information exchange. The second one being telehealth, telemedicine, virtual visits, personal health records, patient portals. So that is basically the everything which is about the connection between the patient and the caregivers remotely. Then there is also the subdomain of mobile health, as well as digital therapeutics, the subdomain of digital imaging packs and image analysis, then the so-called digital reality subdomain or virtual augmented mixed reality, as well as robotics and gamings, a separate subdomain of sensors, wearables, remote patient monitoring, and what we call ambient assisted living, health data analytics and artificial intelligence, and of course, eventually the digital biomarkers, omics, such as genomics or genomics informatics, and precision medicine. So quite a wide domain. So we promised to speak briefly about the efforts of the World Health Organization in promoting digital health. Of course, the WHO has been active also decades earlier, first with telehealth, pretty much following this evolution and development of the domain of ICT for health. The very first, probably one of the first instances when the focus shifted on digital health and continued essentially or built on top of the WHO efforts in e-health and expanded the domain and again emphasized the importance of digital health was in 2018 at the 71st session of the World Health Assembly that adopted resolution on digital health, which proposed that the Director General develop in close consultations with member states and stakeholders a global digital health strategy, identifying priority areas, including those on which the World Health Organization should focus its efforts. And the strategy then began the development of the global strategy of digital health. In 2019, WHO suggested the first classification or draft classification of digital health interventions. That is actually right now inviting input by expert community and by professionals for further development, for further evolution of that classification. Right now, as we speak, WHO is inviting commentaries and contribution to further refine that classification. In 2019 also saw the publication of Digital Health Guidelines, 2020 Digital Health Platform Handbook, and then in 2021 was published the finalized Global Digital Health Strategy of 2021-2025, Digital Implementation Investment Guide, Guidance, Ethics and Governance AI in Health. And just a few days ago, actually on September 12-14, at a meeting in Tel Aviv, Israel, the WHO European Office or Regional Office for Europe adopted the very first draft Regional Digital Health Action Plan specifically for Europe region of the World Health Organization, plan for 2023 through 2030. That plan is based on 5 guiding principles that are listed here, but I will probably skip those and rather emphasize the 4 strategic priorities that are suggested in that plan. The priority number 1, setting norms, developing evidence-based technical guidance, and formulating direction to support decision-making in digital health. Strategic priority 2, enhancing country capacities. And this is where we are going to focus more a bit later, to better govern digital transformation in the health sector and advance digital health literacy. So we're speaking here about capacity building, right? Priority 3, building networks and promoting dialogue and knowledge exchange. And priority 4, conducting horizon scanning, as they call it, and landscape analysis to identify solutions that are patient-centered and can be scaled up at country or regional level to help shape public health and health systems in the digital era. So the importance of the workforce and user group training and capacity building in for digital transformation of health cannot be overemphasized. A skilled and competent health workforce, as we all understand, is a vital component of any health system. Now, in a digital health system, and this is how I like to call, and I'm quite convinced that in a few years, or probably a decade from now, we will all be speaking of a digital health system, right? A health system that is either undergoing or at least has already undergone at least some forms or some parts of digital transformation. So in a digital health system, traditional roles of health workforce will need to be transformed. As an example, the physicians should be able, all of them, to perform, let's say, online consultations, right? Or any to engage in remote activities, in remote encounters with patients. as well as with informal caregivers, as opposed to in-person visits. There will be a need to use these multiple e-health tools, such as e-prescriptions, clinical decision support systems, and all other components of electronic or digital health records, and so forth. So the health workforces will be positioned at the critical stages, critical component to enable the digital transformation of the health system. However, health professionals are facing challenges nowadays, right? Such as the lack of knowledge, skills, sometimes even motivation to work with digital health tools and interventions. And furthermore, there is also a need for a dedicated digital health workforce, professionals that will be needed to design, develop, operate, and maintain digital health solutions and tools. And we're expecting that there will be a massive need for such professionals in order to support digital transformation of healthcare. According to some estimations, there will be as many required as in the range of 30,000 specialists over the next 3 years in the UK, or about between 35 and 40,000 specialists in the not basically in the 3 years, but until the end of the current decade. 40,000 specialists for a nation like Germany, and so forth. So the strategic approach to workforce development and to capacity building in digital health we're suggesting that it should be based on 3 user groups in the following 6 key aspects: to identify those user groups and their subgroups with their respective roles, to define the necessary knowledge, skills, and competencies, or KSC mix of the user group, to describe the current state of the user group. Then the next would be to conduct a needs assessment to identify what are the gaps in terms of education, training, and development of these user groups, to develop approaches to education, training, and development of the specific user group, which educational offers, how they should be designed and delivered, and so forth. And of course, also to assess the challenges and risks, and to provide or to design mitigation measures. With regards to the user groups, we suggest the following 3 user groups. This is based off of course, the earlier efforts by the World Health Organization in early 2000s or late 1990s, and has been reflected in previous guidances on e-health strategy or strategic development of e-health action plans to member states. Back then, we identified, or the WHO suggested 2 groups of e-health back then. Once again, we were talking about e-health. So 2 groups of workforce. Group 1 being, we call it now digital health workforce, or health ICT specialist. And here are those specific workforce that I mentioned earlier, those who should be driving the development, the digitalization of the health systems, basically. So digital health specialists or digital health professionals, including the managers, administrators, or strategic developers of the digital health system, information management or informatics specialists, technical staff, data protection specialists, data specialists, ethics specialists, and assistant staff. These are the main subgroups. The group 2, as opposed to digital health workforce, digital health specialists, are all other healthcare professionals, including physicians, dentists, nurses, allied health professionals, and support staff, such as healthcare assistants, nursing assistants, public health specialists. And in the most recently, later on, to reflect this movement from e-health towards digital health, with a focus on digital consumer, with a focus on citizen, we suggested the 3rd group of users of digital health system, that is empowered citizens, the patients and the caregivers. The strategic development of the workforce in digital health systems is closely related to assessment of required knowledge, skills, and competencies, where knowledge is the level of education, experience, or training, while skills denote the ability of a person to perform particular task or job through learning or training, and the combination of knowledge and skills then leads to competency. And the framework of KSC in digital health system is inherently related to the formal education and training. The goal of such training is to have a specialized and recognizable digital health system workforce that is set to implement, manage, and govern. Due to the lack of formal recognition of digital health or e-health as a specialty up to now, the presence of digital health in the core content of education and professional training, as well as the investment work on creating modern and comprehensive digital health curricula or streamlining digital health educational curricula across country borders and across different educational settings, we consider all that to be of paramount importance. What could be the different types of education offers for digital health systems is shown here and on the next slide. We consider the three types of offers, the type 1 being add-on or standalone courses, such as educational certificate courses, similar to these kind of flash courses that are organized by the ISfTeH, courses that are taken as an additional study after primary professional degree courses, capstone projects, CME credits for current practitioners, learning suites, and certificate programs provided also by professional organizations and associations. Once again, pretty much similar to the educational efforts by the International Society for Telemedicine and e-Health. Type 2 would be the integrated or built-in courses. And this should be digital health and or health informatics education courses that are integrated within medical school curricula. And finally, type 3 would be dedicated degree programs that are specifically for training the digital health specialists, as we mentioned earlier. We are absolutely convinced that there will be a need for both bachelor and master level and also PhD programs. There are already quite a number of such study programs available worldwide, and the number of these programs is continuously rising. The major domains of knowledge, skills, and competencies that will be required to train a digital health specialist are listed here. We attempted to, also based on previous data, based on previous efforts, we attempted to formalize a bit. And that work resulted in identification of 8 domains of knowledge, skills, and competencies, ranging from life science, biology, and medicine, through health and healthcare, information science and technology, computer science, data science, biomedical and health informatics or health information technology, to digital healthcare management, with biomedical research and innovation, public and business administration and management, as well as social, some chapters from social, legal, and behavioral sciences. So understandably, as we know that digital health is quite a, not just important, but also a wider domain of knowledge and practice, interdisciplinary or cross-disciplinary domain. Hence, there are competency areas from quite a number of disciplines that need to be part of the digital health curricula in our understanding. Few concluding words. Digital health is the natural evolution of the knowledge and practice domain that is related to the use of information of communication and technologies in medicine and healthcare. Digital health is currently in the focus of global and international organizations such as the World Health Organization, as well as national and regional governments, health and technology businesses, like we saw in the very first short episode from the Tim Cook's interview, as well as in the attention of the wider public. Workforce training and capacity building is of paramount importance for digital transformation in healthcare. In particular, we expect that there will be a massive need for digital health specialists to support digitalization and digital transformation of the health systems. National governments should strategize approaches to digital health education through defining needs and requirements, developing educational offers, and monitoring progress. And finally, further development and maturation of digital health education requires common understanding and concerted efforts by global and national players, regulators, and all stakeholders. Last but not least, I'm going to probably skip these few slides. I just wanted to present in few words what we actually do, mostly as the master level digital health study program that was established in 2015. This is where the university is located, Deggendorf Institute of Technology, that currently has about 8,500 students. It's one of the most internationalized, actually, universities in Bavaria, in South Germany, with about 30% international students. And we indeed prepare digital health specialists, first and foremost, those that are supposed to drive innovation and leadership in digital healthcare. More information on the program can be found on the website, of course. And this is my last slide. I very much would like to also invite all our attendees to check and to attend the Digi Health Day series that we are organizing every year. This year it will be on November 11th, both virtual and on-site. This is also an event under the auspices of the ISfTeH. Thank you for your attention. Should there be any questions, I'd be happy to answer them.
Yes, thank you very much, Georgi, for your insightful presentation. It's very nice to hear your broad approach to the needs of educational training, capacity building for all those who are involved in digital health, not only health professionals, but everyone else. Thank you very much for being with us, Georgi.
Thank you, Joseph.
Welcome. There is a question for one of our attendees, Flori Brizel, and she asks, what do you mean by developing mitigation strategies for user groups? What exactly must be mitigated?
The risks. We're speaking about the possible challenges, because pretty much the same way as digital transformation itself is associated with quite significant challenges. So there is always this dimension of identifying what could be the obstacles and what could be the challenges or what could be the risks and how these could be approached. This is what we basically mean by identifying risks and defining the strategies of mitigating those risks. That is more or less a standard kind of wide scope project management component, project management approach. I hope I answered the question. Otherwise, I could have put a lot more detail in that, but I'm afraid our time is not permitting.
Yes, okay. Oh, wonderful. Thank you, Georgi. Let me ask you, from your experience, what are the main challenges for the implementation of the education offers, not only for health professionals, but also for undergraduate students from medical or other health professions, Georgi?
Yeah, this is basically, this is a very good question. Thank you for that, Jefferson. I think it's first of all, it's very important, and this is why we are speaking of strategizing, approaching strategically to developing workforce to building capacity for digital transformation, because without that, obviously nothing would work, right? So the first and most important challenge is to have the vision to define that strategy, and this is why we're currently working on actually preparing sort of a set of guidelines also for national governments on how to strategically approach these capacity building. But of course, that's not it's the very first one. However, not the only one, of course. The first in our understanding is the defining a strategy, having a vision, defining a strategy. Then based on that strategy, of course, the challenge is also finding resources, obviously, right? The building the capacity to build the capacity, so to say, right? The TOT. For example, there are not many countries, even in currently, that have sufficient number of teachers, for example, right, who could be able to support these educational offers. So from vision, capacity, the teaching staff, and financial, and all the way to allowing or creating a supportive environment for such educational courses. And it should be also the leadership of various educational institutions, including medical schools. They in turn should also be motivated and informed about the need to further develop the curricula and the need to incorporate the digital health the modules or digital health courses into the standard medical school curriculum.
Yes, wonderful. And as you mentioned, we still have to teach the teachers.
Exactly, TOT. Right.
TOT.
Yeah.
Thank you. Well, there's another question for you, Georgi, for Maro Rafa Niakabao. What about incorporating entrepreneurship in the knowledge metrics for digital health specialists? You mentioned business administration and management, but not entrepreneurship.
Entrepreneurship, yes, absolutely.
Yes.
I absolutely agree. And this is part of this business studies subdomain that was mentioned in the slide. Thank you for that comment. And in fact, our Masters of Digital Health, we have even one specific, not just module, but subspecialization in our MDH, which is business and entrepreneurship in digital health.
Wonderful.
Thank you for that comment. Very important. Absolutely
Yes.
agree.
Thank you, Georgi. Now we'll move to